All right, we've talked numbers, we've talked systems, we exposed the hypocrisy, and we painted the picture of what's possible. But now we got to be honest about the real reason we still don't have universal healthcare in the United States. Because it's not the math, it's not the logistics, it's not wait times or doctors or hospitals. It's always one thing: power. And it's always been about control. So let's rewind. Back in the 1940s, yes, 80 years ago, President Harry Truman proposed a national health insurance program. He wasn't some radical. He was a centrist, a Cold War Democrat, a president who dropped the atomic bomb. And what happened? The American Medical Association, the AMA, backed by insurance companies, launched a multi-million-dollar smear campaign. They call it socialized medicine. They said it was the first step towards communism. They warned that letting the government help sick people will somehow destroy freedom. And the sad part is, it worked. That playbook, it hasn't changed in 8 decades. Today you can turn on any cable news network and hear the same talking points. Government takeover, loss of freedom, higher taxes. But behind all that noise is one simple truth. They're scared of losing control. Because when your healthcare is tied to your job, your boss owns your body. When you need insurance to keep your kids alive, you're not going to walk out and strike for higher pay. When one wrong move could cost you your coverage, you're easier to control. That's not freedom. That's dependency by design. That's what America wants. And it's not a flaw, it's a feature. Because then let's go. In 2023, the healthcare industry spent over $713 million on lobbying. Imagine how much healthcare we could have with that money. And that's more than oil, more than big tech, more than defense contractors, more than any other industry in the United States. They deploy over 2,700 lobbyists. That's 5 lobbyists for every member of Congress. Why? Because their profit margins depends on your misery. If people got care without copays, deductibles, or denials, United Health stock will collapse. If insulin costs what it does in Canada, Eli Lilly couldn't just buy its 5th jet. If you could see the doctor without fearing the bill, you wouldn't need Aetna or Cigna or the entire fake marketplace we call choice. This system was built to fail you and succeed for them. And this is the other part. The divide, distract, and destroy hope. And here's when it gets even dirtier. When the money isn't enough, they use division. They pit us against each other. They say, why should immigrants get health care? Why should someone who didn't serve in the military get free treatment? Why should I pay for someone else's bad choices? They frame it like justice is a zero-sum game. And it works every time, every freaking time. Poor people are told to resent even poorer people. White workers are told black and brown families are taken from the system. Rural voters are told their cities are wasteful. Urban voters are told rural folks are ignorant. It's the oldest trick in the book. They don't want you to look up. They want you to look sideways, or look down mainly. And so you fight your neighbor instead of the corporation billing you $5,000 for an emergency room visit. And when we fight each other, they win every time. Remember what I said in the intro? The house wins all the time. And what do we do about it? Like, look, we could stop here. We could sit in the anger, the frustration, and the grief. But I didn't build this show to give you despair. I built it because I believe we can change this. So here's what we do. If we do tangible, concrete, and real. Let's go step by step. Step 1, state-level universal healthcare pilots. Places like California, New York, and Washington have drafted proposals. If even one of them succeeds, it becomes a blueprint. Support those campaigns. Join coalitions. Donate. Knock doors. Step 2, ballot initiatives. In states like Oregon, Massachusetts, and Colorado, ballot measures have expanded Medicaid and capped drug cost. Even failed measures build pressure and visibility. They matter. 3. Call out the hypocrisy. Don't let politicians get away with saying, well, it's like, well, we can't afford health care, while they enjoy the fully taxpayer-funded plans. Ask them, will you give up TRICARE? Will you give up your congressional plans? Make them look their privilege in the face. Now let's do the next step. Step 4. Fight for reform on the way to revolution. While we fight for Medicare for all, we can cap drug prices, ban surprise billings, regulate private hospitals, expand Medicaid in holdout states, push for nonprofit hospitals to stop suing patients over bills. And next, step 5, change the conversation. Stop asking, how will we pay for it? And start asking, how are we paying for this broken system now? How many more GoFundMes do we need? How many people have to die waiting for permission from Blue Cross? We don't have to wait for some perfect system. We just need to stop settling for one that's killing us. And this is my story, and this is yours as well. I've been on both sides of this. As a Marine, I had TRICARE. It was simple, it was comprehensive, it worked. I didn't have to choose between a checkup and a paycheck. I didn't have to worry about whether a doctor was in network, and I never had to open a bill in fear. When I left the service, that changed overnight. Suddenly I had deductibles. Suddenly I was undercover. That's the real term, by the way. Suddenly I was paying to stay alive. I've seen people I love skip medicine, delay treatment, work through illness, get sicker, and sometimes not make it. My family, my mom, she decided to skip her. She was diagnosed with breast cancer. She didn't go to a doctor for many years because she couldn't afford it. And guess what? That cancer spread, and she died of breast cancer and bone cancer. So this is personal too. Here's the thing: it's not because she was not lazy. She was the hardest worker ever. And it's not because she wasn't neither patriotic enough. Like, that lady knew more of America than all the whole white America knows in their pinky. She knew more about America than everybody else. But because the system doesn't believe everyone deserves to live, that's what it all comes down to. Who do we believe is worth saving? Because right now the answer is only if you're profitable. And that's the lie. And it ends when we stop accepting it. And here's what my final ask. Here's what I want you to do before this week is over. Because I want you to do 3 things. 1, share this episode with someone who still believes the myth. And 2, ask your rep directly where they stand. No vague access talk. I need real answers. 3, get involved locally. Join a Medicaid expansion campaign, a union, a healthcare justice group. And when someone says, we can't afford universal healthcare, tell them this: we already are. We're just letting the wrong people get rich while the rest of us suffer. It doesn't have to be this way. It never did. And if enough of us say so, we can change this.